Assalamu alaikum. Today we will discuss the osteology of the lower limb. The osteology of the lower limb starts with the pelvis. This is a hemipelvis, this is the sacrum, and this is a hip bone. This is the hip bone. There is another hip bone here, and both are articulate posteriorly, sacroiliac joint, and the two iliac bone articulate anteriorly on the symphysis pubis. Here where there's movement are the symphysis pubis. The hip bone actually consists of three bones. This part we call it the ilium, and this is the pubic bone, and this one here, the L shape, is the ischium. So the iliac bone, this one, and this is the pubic bone here, and this is the ischium. The iliac bone, this is the outer surface of the iliac bone, consists of the following. This is this outer border, we call it the iliac crest. This is the iliac crest. This crest will end here by anterior superior iliac spine. When you move your finger downward, there is another elevation, we call it anterior inferior iliac spine. Okay. Iliac crest, posteriorly, when you move it, there is another elevation here, spine here, we call it posterior superior iliac spine, and another one here is posterior inferior iliac spine. The inner surface of the iliac bone is concave, and there is a rough area posteriorly for articulation with the sacrum. The iliac bone with the pubic bone and the ischium, all of them articulate together in a depression. Here we call it the acetabulum. This is the acetabulum, and this is the site of attachment of these three bones. The other bone anteriorly here is the pubic bone. This is the pubic bone. This is the superior ramus of the pubic bone. Here is the pubic tubercle. This is pubic crest. This is the body of the pubic, and this is the inferior ramus of the pubic bone. Superior ramus of a pubic bone, body, and inferior ramus of a pubic bone. Pubic bone articulate with the other pubic bone through symphysis pubis, through the symphysis pubis, like that. Okay. The other part is the ischium. This is the ischium. The ischium is L-shaped bone, very thick bone, L-shaped bone, articulate with the other bone in the acetabulum, and articulate the ramus of the ischium here, and this is the body of the ischium here. The ramus of the ischium articulate with the inferior ramus of a pubic bone here, and there is here a tuberosity, we call it ischial tuberosity. Ischial tuberosity, where the people usually sit here. Ischial tuberosity. Inner side, there are a protrusion here, we call it the ischial spine. Above the ischial spine, there is a notch, we call it greater sciatic notch, and below the spine is another notch, we call it lesser sciatic notch. There is, from the sacrum from the sacrum to the spine, and from the sacrum to the tuberosity, ischial tuberosity, from the sacrum to the ischial spine, and from the sacrum to the ischial tuberosity, there are two ligaments, sacrospinous and sacrotuberous ligaments. These will convert these notches to a foramen, greater sciatic foramen and lesser sciatic foramen. Very important structure will pass through these two foramen. Here we have what we call obturator foramen. We call it obturator foramen. The most long bone, the longest bone in the body is the femur. The femur consists of the head of the femur. This is the head of the femur. This is circular, and it enters in the acetabulum. Look at the acetabulum here, to form the hip joint. To form the hip joint. The head is a circle. In the circle there is a depression. This is, we call it fova capitis, for the ligament of the head of the femur. Fova capitis, a depression. And the head here had neck. The neck articulate with the body of the join the body of the femur. The neck and the shaft, this neck and shaft, has an angle which is very important, because excessive angle would cause coxa valga, and less angle will form coxa vara. Here, this elevation here, we call it the greater trochanter, and here is the lesser trochanter. From the anteriorly, in the anterior surface, here the anterior surface, there is a line that passes from the greater trochanter to the lesser trochanter. Here we call it the intertrochanteric line. Intertrochanteric line. The shaft of the femur is round and long bone, and it ends here by a depression for the patellar fossa, and here is the medial epicondyle, here is the lateral epicondyle. On the posterior surface, this is a greater trochanter, this is the lesser trochanter. There is a crest between them, intertrochanteric crest. So anteriorly line, posteriorly is a crest, يعني ارتفاع هنا مثل الأرض. And here is a very, very sharp end, very sharp edge. We call it linea aspera, where the facial septi fused. Linea aspera. The linea aspera will pass downward, and it will here form the medial ridge, and here is the lateral, here the medial ridge, and here is the lateral ridge. Inferiorly, there will be a medial condyle, big one, lateral condyle, and intercondylar groove here, intercondylar groove. Now here is the medial epicondyle, and here is the lateral epicondyle. This is the, and this is the fossa for the patella. This bone anteriorly here, we call it the patella. The patella is a sesamoid bone in the tendon of the quadriceps muscle. شكل مثلث, the apex above this is the patella. The femur articulates with the tibia to form the knee joint. The tibia is long bone had 3 surfaces يعني شكله مثل المثلث المقطع العرضي مالته. Here above we have the condyles. This is the medial condyle and this is the lateral condyle of the tibia. Between them there is an elevation. We call it tibial eminence. These are the tibial eminence. So this is the medial condyle, this is the lateral condyle, depression for articulation with the condyles of the femur, and the menisci are here. The menisci will be situated here, and this is the eminence. This is anterior eminence, and this is the posterior intercondylar eminence, where the anterior and posterior cruciate ligament are attached. This is tibial tuberosity, where the tendon of the quadriceps attached. احنا نسميه patellar tendon attached, this elevation. Here is the anterior border, thin, اللي هذه نسميه shin, under the skin. This is the medial surface. This is the interosseous surface. This is the lateral surface. This is the interosseous border, and this is the posterior surface. The lower end of the tibia elongated here to form this projection. We call it the medial malleolus. Medial malleolus, and there is a fossa here for articulation with the patella, with the fibula, and here also above for articulation with the fibula. So this is the upper tibiofibular joint, and this is the lower tibiofibular joint, which is joined by multiple layers of fibrous tissue to form what we call syndesmosis. The fibula is a cylinder bone, 4 surfaces. Actually, it not hold weight of the body. This elevation, we call it the stylodoprosis of the fibula. And this is the head of the fibula, this is the neck of the fibula, and this is the shaft of the fibula, and here is the elongation downward. This is the lateral malleolus. This is the lateral malleolus. The medial malleolus, the lateral malleolus here, look, this is the medial malleolus, this is the lateral malleolus. Both of them will form with the talus, this talus, form the ankle joint. This is the talus, the part of the ankle joint. The talus had the following criteria. This is the head of the talus, this is the neck of the talus, and this is the body of the talus. The talus articulate with the tibia and fibula, forming an ankle. The talus articulate with this bone. This is the navicular bone. And inferiorly, the talus articulate with this bone, اللي هو the calcaneum. calcaneum حقيقة شكله hexagonal، يعني مثل المكعب هالشكل، hexagonal. Above articulate with the talus. Anteriorly, it will articulate with the cuboid bone. This is the cuboid bone. The talus, these are the lateral tubercle of the talus, and this is the medial tubercle. This is the medial tubercle of the talus. And here is a shelf. This here is a shelf. This shelf in between my index and thumb. This shelf is called sustentaculum tali. So the talus articulate with the cuboidal joint or subtalar joint, and the talus articulate with the navicular, and the calcaneum articulate with the cuboid. Here there are 3 cuneiform bones. This is the medial, middle, lateral cuneiform bone. And here we have 5 5 metatarsal bones. 5 metatarsal bone. This one, the first one is the big one. First one, this is number 1, number 2, number 3, number 4, number 5. Number 5 حقيقة, there is a prominent here tuberosity, we call it peroneal tuberosity. And مثل ما أخذنا بالأصابع اليد, this is حقيقة هنا راح نلقى big toe have 2 phalanges, the other have 3 phalanges. This is the metatarsophalangeal joint. This is هذا when they أشر القلم هنا metatarsophalangeal joint. This is the proximal interphalangeal joint, and this is the distal interphalangeal joint. شكرا جزيلا.